Good evening, everybody. Welcome to the FY2 Booster webinar. I hope you guys are doing well. Great to see so many of you guys on board already from the start. I can see some names that I recognize from the FY2 Academy, which is great, and lots of new names as well. Welcome to everybody. It's great to see you all. We've got expecting around 150, 200, maybe 300 on tonight. We've got quite a lot registered on the webinar, a lot of interest in FY2 this year. So really good to see people are getting ahead of preparation. Obviously, we're going to go through some key timeline dates, but exam is coming up pretty soon, the SJT exam. So it's good to see all of you guys are on board. Can you give me a yes, guys, in the chat? If you can hear me, you can see me. Let's just make sure all is going well. Fantastic. Welcome. Welcome. Good to see some names. Hello to all of you guys as well. It's great when you see people going through different stages of their careers and people moving on up the NHS ladder. It's so good to see. Welcome back to a lot of you from FY2 days, and welcome to a lot of people that are brand new to us as well. So what is the plan for today? By the way, guys, one chance, if you can just get people on. We have marketed this webinar fairly late, so I don't think it's reached everybody that potentially could find this of value. So I put the link in the chat. Please do grab that link. Please do put it in any Facebook groups, Telegram groups, WhatsApp groups where you know there are doctors who are potentially taking this exam in a couple of weeks' time. Let's try and help as many people as we can. Thank you to those who've done that already. We can see people joining us as we speak. Dr. Pooja is also on the webinar tonight. She'll also be answering any queries, questions, doubts that you might have about the assessment. I know there's a lot of questions that people have about this particular assessment. It's quite an unusual assessment. You don't really get this type of question anywhere else. So there's a lot of queries about it. So Dr. Pooja's in the chat. A lot of you guys obviously know her from Academy days as well. So please do ask any questions. We can see everything that you're putting in the chat. We keep the chat hidden just because when the questions go live, lots and lots of answers start to come. So we don't want to distract you from the answers, but we can see everything that you're putting in the chat. So it's great to see some comments coming in already. Yes, it's good to see you guys as well. So I think we've got about enough people on to get going then. The people are obviously going to join us as we go. But what is the plan for this evening? Quite a lot to pack in really to the next hour and a half. So we're going to quickly go over the timeline because, just to get those dates right, so you can kind of screenshot that slide just to make sure you can put your things in place in terms of when things are happening. Obviously, lots and lots of SJT questions. We've got quite a lot in store for you today. I'm just going to keep going until we get till the end of time because I'm not quite sure how long these are going to take, but we've got quite a lot of questions to go through, lots of examples. We'll look at common mistakes. We'll look at technique in a big way. I think with these types of exams, particularly SJTs of all types, not just this, but also say MSRA, SJT as well, a lot of it's around technique. And if you don't get those subtle things right, it can make a big difference going on as well. And then hopefully by the end of this, boost your confidence. I can see from the queries that are coming in from people using the question bank and the mocks already that a lot of people have a few uncertainties about this type of question. So hopefully by the end of this, we'll have boosted your confidence and we'll end up giving you a plan for the next 4 or so weeks leading into the SJT itself. And as always, webinar only offer, just put a link in the chat, 15% off the FY2 Plus package for tonight only, for those who are attending the webinar only. That will go on till midnight tonight, UK time, or until 15 coupons have been used. So that's all coming up later on in the webinar. If you've already got the package, I'm really sorry we can't do retrospective, but hopefully you're getting some value out of it already, even though you have got, there'll be a lot of people on this webinar who've already got this package. This is for people who haven't got it so far. So if you are new to us, welcome. I'm Dr Aman Arora, Portfolio GP, now 24/7, 365 medical education. My passion is to get you guys not just through the exams that you have to take, but also hopefully see you through multiple layers of your journey in the NHS. So like we said, I've had a lot of experience of you guys already coming through the PLAB pathway. A lot of you guys have been through the academy, which is great to see. And hopefully we'll keep on helping you through multiple stages, getting into specialty training. If you're going into GP training, getting you out of GP training for MRC GP. So a lot of different experiences that we have of IMG doctors at different stages of their career, and non-IMG doctors as well. So this is obviously the FY2 component, but a lot of different roles within medical education in the past, and I used to write SJT questions for the MSRA exam, so I kind of know how technique plays such an important part in these particular questions. Very proud to be a fellow of the Royal College of GP as well, as is Dr. Pooja, who is also on the webinar tonight. Guys, just put an X in the chat if this is the first time you've been on any Arora webinar. Let's just see how many of you are new to us tonight. Put an X in the chat if you're brand new to us. So there are a fair few X's coming through. So welcome, firstly, welcome to your first Arora webinar. Hopefully it's not the last. I don't know what particular, some of you are putting X. I know you guys are not on your first webinar. or maybe I'm getting confused with coming to the academy, but I certainly know some names who are putting X's in here. But welcome if you are brand new to us. It's great to see you guys on board. I don't know what stage of your journey you're at, but hopefully we can help you in several stages to come. So this is what's coming up then. This is what the coupon is. 15% off our FY2 plus SJT package. So this is kind of everything that looks at from a knowledge and a technique point of view to get you through the exam. So we've got our FY2 SJT question bank that people are usually starting with and that people are using at this point. Then we've got some mocks to do closer to your exam. We've got a live course, which is on the 24th of February, and that's a watch back course as well until the exam if you can't attend it live. And then we've got some SJT flashcards. So everything is geared towards that one single exam. Obviously, FY2 SJT this year has blown up in terms of competition. So getting your score as high as possible is much more important than it probably was in previous years. And that's why we brought this package out, because there's a lot more emphasis on this particular exam than there used to be. So that's what the coupon is coming out. Like we said, there are going to be 15 coupons available, and it's going to be till midnight tonight if you haven't already got the package. I know a lot of you guys already are using this, which is fantastic. Okay, so let's quickly go through. Firstly, welcome to everybody else who's joined us. We've had another 20 or 30 joined in the last 5-10 minutes, so welcome to you guys as well. So let's quickly go through the basics then. You guys probably know this if you're already in the middle, but I know there are some people on this webinar who are thinking about this for next year then. So FY2 is a standalone one-year training program. That's why it's so good, because you get your training things signed up as well. It's not just a standalone job like an SHO locum, for example. Application is run by the UK FPO. Obviously, stage 1 is your SJT exam, situational judgment test, and we'll talk about this in more detail shortly. If you're successful in this, then you move on to the next stage, which is your interview stage. We've got a whole new package for that coming up for those of you who get through. And if you're successful in your interview, then you're asked to preference or basically rank your FY2 programs. And then offers are based on how well you do in your interview scores, based on how you ranked your FY2 program. So we'll cover this in more detail in a webinar for the next stage, we'll do later. But just so you have a plan in your mind, this is what you're coming up against in the next few months. Sometimes there's a clearance round. It kind of depends on what the competition ratios are and how many people are doing it. But I don't think this year we're likely to have that, because I think there are just so many people applying for FY2 compared to other years in the past. This is what you want to screenshot, by the way, if you are just thinking about dates and kind of plan your next 2 or 3 months. Get this screenshot on your phone so you can quickly look at this at some point in the future. Going onto the website is quite tricky sometimes, trying to get those dates out. So the SJT exam booking obviously starts from tomorrow. So you guys no doubt are going to be getting yourself booked on in the next week or so. The exams are 27 days to go. So it is from the 4th to 11th of March. So we're into that kind of final phase now of preparation. Results about a month or so later. On the same day you book your interviews, if you're successful, you can book your interview from the same day. You've got 4 days to book your interview. Interviews take place between the 24th and the 30th of April 2025. And the aim is obviously that you get through all of this and you start your FY2 post in August 25. Seems a long way away, but it's going to come very quickly, and all these steps are going to creep up on you if you haven't got them planned in your mind. So take a screenshot of that and try and bear it in mind in terms of how you prepare for the next few stages. Okay, welcome to everyone who's just joined us once again. Thank you to everyone who's grabbed that link. I can see a lot of people have grabbed that link and put it out to the world, which is fantastic. How are you feeling, guys? One word. Let's just sum up the vibe on this webinar then. How are you feeling about FY2 SJT? Let's get a few honest answers. So a lot of you are saying anxious, nervous, stressed, nervous, worried, unsure, excited. Got a couple of excited, hopeful, thrilled. Bit worried, bit stressed, anxious, worried, nervous. So the reason we put this out there and we do this is because if you are feeling nervous, stressed, anxious, firstly, you're not the only one. Lots and lots of people feel exactly the same. And secondly, I would feel unusual kind of if you didn't feel a little bit nervous, because it is a high pressure exam. A lot of you guys have passed previous exams and you kind of now into the next phase, and it's a big deal getting through this. And getting an FY2 post is a big deal. Competition rates are high. So I'd be surprised if you weren't a little bit nervous. Also, added to that, the fact that it's a brand new exam. You won't have taken an exam like this before unless you did last year's FY2 SJT. It's a completely brand new exam. So you must be a little bit nervous, and that's reasonable. But just to put it out here that every single person, bar 1 or 2, has said the same as you. So if you're feeling any of those vibes at the moment, it's fine. That's why you come on these kind of webinars, just to understand the process a bit more and hopefully build up a little bit more confidence in terms of how to approach your preparation and ultimately the exam as well. Is there an estimate of how many people are applying? I think Dr. Puja can put some numbers and things in. It's hard to know, but it's very, very high in terms of competition, just because people are struggling to get those jobs, the standalone in this kind of cycle, things tend to go up and down when it comes to jobs. And we're in a very tough cycle at the moment. Okay, so let's talk a bit about the FY2 SJT paper. Then it's actually over in a flash. 45 minutes is not long at all compared to some of the exams you've just done, PLAB 1, PLAB 2, etc. It's a professional dilemma paper, so it's not testing any clinical knowledge at all. It's looking at your approach to different situations that you might find yourself in as a junior doctor, and they're looking to see how do you approach those by understanding things like GMC good medical practice and knowing what's expected of a foundation year doctor, and then being able to work out at that point of time, critically, not guessing, but rationally, why I'm choosing a certain answer. So it's kind of harder than it looks. Sometimes you look at this kind of question and think, some people think, well, it's just common sense. You just go in there and just do common sense stuff and it should be fine. When every single mark counts and, you know, jobs are on the line, every single mark is important, and therefore technique is so key, and that's what we'll focus on for the webinar. 20 different scenarios, so it's not a huge number of questions that you're getting, but each scenario, of course, has 4 or 5 different options. So looking at between 80 or 100 different decisions that you have to make, and that's where you obviously get scored on. So there's enough in there to get a good overview of how you think about certain professional situations. You've almost been tested already in terms of clinical acumen. Now it's about how do you fit into a working environment, and that's why this paper is sometimes very different to ones that you might have done before. So every single scenario, each of those 20 scenarios, you're given 4 or 5 different options or action points, and you have to rate those from extremely desirable in terms of how you see that action into all the way down to extremely undesirable. Now, when people are doing the question banks, they're putting a few questions back to us about why is this not slightly, why is this not extremely? And, you know, a lot of this is perception and how one person sees something is slightly different to another. But as long as your overall pattern is coming out on the right side rather than the wrong side, if you're putting more in desirable than undesirable or vice versa, depending on which way around it is, there are some that are really obviously extremely, but actually it's all about the kind of patterns that you're looking at rather than the exact terminology. And we'll try and break these words down as we do examples and give you some examples of why this is extremely versus slightly. And it's all to do with things like how many things are you achieving or not achieving in a statement, and we'll cover this in a second. But it's actually quite a strange type of exam to do, because if you think about the MSRA SJT, there you're ranking things. So you have 5 options and you have to rank them. This is the best, this is second, this is third, this is fourth, this is fifth. Whereas in this type of assessment, you could get 3 options that all end up being slightly desirable. So you're not almost playing one against the other. It's all about looking at each one as an individual option and thinking, how would I categorize this? Even if it means that 3 of them end up being the same, that's fine. Whereas in a MSRA SJT, you're almost looking at, well, one has to be better than the other. And it's a slightly different mindset to be in. And that's why it's important to practice these types of questions, because there's not many opportunities to do this type of thing. 4 marks per option is what the kind of maximum is per scenario. And this is all worked out in statistical analysis. So you're not going to know how exactly they calculate it and how exactly what mark you get if you put extremely, but it's supposed to be slightly. That's all kind of internally calculated, but which is why we tend to say, if as long as you're getting the right sort of patterns, and when you're doing the question banks and the mocks, you're seeing that the majority are falling in the right sides, then I wouldn't worry too much, because you're getting the right idea. And the more you do it, the more buzzwords you pick up, and the more you'll realize this is extremely versus slightly. But early on, I really wouldn't worry too much. It's just about getting that kind of pattern style into your mind. Now, just like any other exam, SJT technique is really, really key. Now, at Arora, we talk about 4 C's to bear in mind. Sometimes you get some really obvious answers. This is obviously extremely desirable or obviously extremely undesirable. But sometimes you get those middle ground ones where you're like, is it slightly desirable? Is it neither nor? Or is it slightly undesirable? And this is where your 4 C's that we talk a lot about can help. So these are not to be used in every single question. It's just for those questions where you think, I'm not quite sure. Is it A versus B? How do you make those decisions? This is where technique can make a difference. So a couple things to bear in mind then. So C number 1, clinical. Is there anything in here that suggests either a patient safety issue or a personal safety issue? We'll talk about examples of both as we do questions. Convenience to you as a junior doctor, a trainee, for example. Either are you even asked to stay late? Are you even asked to come in early? Are you even asked to miss certain things, training goals, needs, etc.? What's the convenience factor to you? And what's the convenience factor to others, other colleagues, other patients, other relatives, thinking about how they influence whether it goes up or down the list. Communication can be in terms of communicating to patients. Is there anything that I need to be doing in terms of a certain type of communication? I'm running late. I need to let them know. This person's angry. How do I communicate that back to the patient? Someone's embarrassed. What's the communication that I need to think about? So you've got your patient communication, and then you've got your colleague communication as well. So, for example, if you're running late, or if you're keeping one of your colleagues waiting, or something like that, what's the communication that I need to my colleague? Do I need to be setting anything up, or how important is it to communicate something to my colleague? Is it a handover, for example, to one of my teams? Is it communicating to one of my seniors in terms of talking about a patient who's unwell? Communication both ways is important. And then you've got C number 4, colleague support. So what colleague support have I got available to me? So, for example, can I delegate? Can I ask for help? Do I need to go to my senior for this particular situation? And what kind of colleague support might be needed by my colleague? Is my colleague struggling? Do they need support? Who's the best person to signpost them to? Again, all these C's can help you just think about things in a slightly frameworked approach, rather than just, well, this sounds all right, this doesn't sound all right, let's have a guess here, a guess there, because this exam is too high value to guess too many answers, and having something to fall back on is really important. So we'll talk about these in more detail as we go through our questions tonight. A couple of other things I want you to bear in mind when you read these questions. What are the ideal end goals, stroke goals of a situation? So you're put in a situation, you've got to almost think, what's the 1 or 2 things that ideally I would like to have achieved in this situation? And then when you look at your options, you can see how many of those 1 or 2 things are covered in those options or not covered in those options, and therefore how good or how bad is it? Sometimes when you just look at a statement, it's kind of like, well, is it slightly or extremely? If you have some kind of idea of, well, this is why I ideally think should happen, there are 2 things here really going on. This statement gives me both of those. So this sounds extremely desirable. This statement gives me one, but not the other. Maybe that's slightly. Can you see how you can start to think about that from a technique point of view when you have an idea of what your end ideal goal should be in a situation? And that's a really important thing that we'll talk about when we do our questions. And another really important thing is what seems right versus what seems right now. Sometimes you look at some statements and some options, you think, that sounds like a good idea. That sounds like actually a pretty decent thing to do. But then you've got to think, is that going to influence this situation in any way? It sounds like a good thing. So your brain starts to think, oh, this is extremely desirable. But actually, when you think about what influence is that action going to have right now in this situation, then maybe it doesn't actually sound so good. It might sound good in the future, but at this point, it's not really a desirable action because it doesn't have any impact on the actual situation. So what seems right, which is what your brain will think often, versus what seems right now, is a really important differentiation to make when you're thinking about slightly extremely desirable versus undesirable. Okay, so these things will come to life a little bit when we do our questions, but I just wanted to put them out there at the beginning just to show you that there is a bit of technique around this. It's not just about this sounds all right, this doesn't sound all right, and therefore that makes a big difference. Okay, so I'm going to put those out there, maybe take a photo of it, screenshot it, and you can use it as you go through the questions when we start. Okay, so we're going to start the questions. Firstly, welcome to everybody who's just joined us. It's great to see so many of you guys on board. We've had a few requests for the coupons already. The coupons are coming later. I promise we're going to do some questions first. The coupon will come a little bit later on in the webinar, I promise you. Okay, right. So are you ready? Let's get some yeses in the chat. When we start getting some yeses in the chat, then I'll know that you're good to go. And then we'll get the first question up and running. Okay, lots of yeses coming in with exclamation marks, which is always good because it means that you really are ready. Okay, so I'm going to go silent on the next screen. You're going to see the first statement and you're going to see the first option. Now, what I want you to do in the chat is put A, B, C, D, or E, and the code will be in the top right. A is extremely desirable, B is slightly desirable, C is neither nor, D is slightly undesirable, and E is extremely undesirable. You'll see the key in the corner. All I want from you guys is an A, B, C, D, E. We're going to give you one statement at a time. Okay. Now, I'm interested in 2 things. Number 1, obviously, would you get it right or wrong? That's one thing. That's a minor thing for me. But what's really important to me is how quickly are those answers coming in and how do they reflect whether you've got it kind of vaguely right or vaguely wrong in terms of the suggested answer. That will tell me a lot about your technique. Okay. So the moment you think you know A, B, C, D, E, put it in the chat. It's hidden. No one else can see what you're writing. Doesn't matter if you get them all wrong. I'd rather you just try them all and get a bit of experience. That's the best way that you're going to learn with this type of question. Okay, so I'm going to go silent. You're not going to have very long in the exam to do each question. So I want to give you a small amount of time, probably longer for the first few, and then I'm going to go at them quite rapidly. and then we'll talk about the suggested answers and why and some of those concepts in a bit of detail. Right, so we had loads of yeses coming in, which is fantastic. I'm going to go silent. First question coming up. Let's go. Ten seconds, get something down. Okay. Okay, I'm going to call it there. I think loads of people have put an answer in. We've had every single answer, by the way, A, B, C, D, and E, which is a good start because that shows me that everyone's thinking slightly differently. And my job is to try and funnel it all down. So by the end, you're thinking the same kind of thing. So every single answer has been put in the chat. The common ones are B, C, and D. B, C, and D, which tend to always be the common ones. B, C, and D always seem to be the common ones. But that's where we are, okay? So some of you thought this is extremely desirable, and some of you thought this was extremely undesirable, and everything else in between. You can see how there's such a variation on what people think. So let's break this down now. You're on a train when it is announced that a passenger has collapsed and an inquiry is made as to whether there are any medical professional on board, which is you, of course. The passenger is traveling alone and is reported to be conscious. The next stop, where you are due to get off, is only 10 minutes away, and there is said to be paramedics already waiting there. You are planning to meet a friend for lunch and worry if you attend to the passenger, you will be delayed. Now, some of you, firstly, are writing more than one answer. So I can see like B, C, D and A, B, C. You just choose one. Firstly, you just got to choose one. Is this A, B, C, D, or E? And secondly, just to save you time, some of you are actually writing out neither desirable or undesirable. Please just write A, B, C, D, E. Don't worry about typing out. Just put the letter, okay? Just going forward in case I forget to mention it. Right, so let's think then. You've got a situation here. What are the two ideal things that really you should want to happen? Number one, this person ideally needs to be assessed. Remember, under good medical practice, we are obliged to help somebody clinically when we're in another environment apart from a clinical setting. So that's number one. So ideally, we want to assess that patient. And number two, ideally, before we leave that train, we want to have done a handover to the paramedics. So that becomes your goal, right? You've got your two endpoints. Number one, assess the patient. And number two, do a decent handover so you can happily move on and kind of not think about further care. You've done the bit that you need to do because you have still got something that you need to do. Remember, we talk about convenience for self versus convenience for others. This is an example where you also got to think about convenience for self as well. You've got to get off a train. You can't just stay on the train forever, for example. So you've got to weigh all this up. So the suggested answer is slightly desirable. Now, how do we come up with that? Think about those two end goals. Number one, assess the patient. Number two, do a handover. So let's talk about this one. Take a detailed history and leave a written note for the paramedics explaining that you had to dash. Now, clearly this is an okay thing to do because you are doing something positive as opposed to some of the others that will come up later. But is this the gold standard? Could this be an A? Take a detailed history and leave a written note for the paramedics. Now, the one thing that changes this from A to B is that you're doing a written note as opposed to verbally handing over to paramedics. Can you see why that's not extremely desirable? The most ideal goal is to do an assessment and do a proper handover to your colleagues who are going to be responsible for taking over the care of this patient. Therefore, A is a good thing. When you read it first line, I can see why you guys thought A initially, because it sounds pretty good, but actually it's not at the top because you haven't got both of those end goals in place. So therefore, it drops down a rung to slightly desirable. Now, if you just read that and thought, let's just have a bit of a random think about it and come up with a random thought, what should it be? Can you see how you might not end up with a logical process that allows you to pick out a 2 out of 5 option? Now, some of you guys put down E, for example, extremely undesirable. Now, I wonder if that's because you're thinking things like, well, I'm not really in a hospital environment. That's not really my patient. I'm not really on duty. Is it right to stop and do all of this? I don't know why you thought about that. But remember, GMC Good Medical Practice tells you that we are obliged as citizens to help people when they need, whether in a hospital setting or not. So I wonder if why some of you guys put the lower answers for that. Some people put C. Neither desirable or undesirable. This is one of those challenging ones. Like, when is it neither desirable or undesirable? We've got some examples of this coming up later on. But you can't really say that because this is actually something you are taking action. You are helping somebody in need. You are doing an assessment. So it can't really be neither nor, because neither nor kind of means you're doing either nothing at all, or you're doing something that weighs up the other, like one positive and one negative. This one doesn't really have one positive versus one negative, and it's not that you're doing nothing altogether. So you can't really go in that middle ground. And often what your brain does is when you read something, you think, I'm not quite sure about that. It kind of goes into the C bracket. But you really need to have a strategic reason why something goes into the middle, not just because I can't quite figure it out and therefore I put it in the middle. Okay? Now that's just one question of many. We've got lots to come. But does that make some sense? Like, does that kind of, can you see with a rationale why, how you come to a decision? I'm not worried about whether you got the exact right decision or not. It's about the rationale, about I've got to think of a strategy rather than just it sounds good. Does that kind of make some sense? Just put an X in the chat or something, just so I know that that's strung the right note, at least as the start of the webinar. Good, excellent, fine. Now I've got people coming in, people saying why I thought E. I thought it was E because it would be unacceptable to leave the situation before physically meeting the parent. So I see what your point you're saying is that, okay, because I didn't physically hand over the patient, it drops it right down to E. But can you see that actually there are so many more worse things that you could do for this than this, what's been said here. So to put that right down to E is a big call, because then really, what do you need to do to get anywhere above extremely undesirable? Do you see my point? So you have to kind of grade it from what's my end goal and how many of those things have been achieved. And therefore that can't really be an E, because it's not like you just walked away and said, it's not my fault, it's not my problem, because that would be an E. Can you see the difference? Yeah, good. So your first thought is not always the rational thought, and that's really important to bear in mind. Fine. Someone's kind of taking it forward. We are obliged to help the patient. So shouldn't we be present with the patient when we hand them over? So that's kind of taking it too far now. Yes, you're obliged to do an assessment, but there's nothing about being obliged to stay forever until you need to do the next thing. Can you see the difference? Like, you can do a quick assessment, realize they're not acutely unwell, they don't need a 999. I'm happy for them to stay until the paramedic and go. Can you see? But you've done the assessment. You can't say I've done the assessment and it ended up being, it hasn't told you what they've got. They say she's conscious. It's not saying that she's got an acute anaphylactic reaction and you're about to walk off. It's just saying assessment. Now, this could be you do an assessment and it actually sounds like a viral infection who's had a faint, and you're happy for them to move on. Can you see the difference? You can't add information into something and extrapolate. You can only go with what's been given to you. Good. Definitely taking statements at face value. You should never be trying to add things, take things away. It's at face value. Okay, great. A few questions coming in. Why is it not this? Why? I'm going to do some more questions and this will all make sense. I promise you. Okay. Okay, I'm going to go to the next one. Let's go. Okay, I'm going to pause it there because 95% of you have put E straight up, like straight out, without even like 5 seconds almost gone. It's E, 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 E. There's some of you put D, and we'll talk about the difference in a second. So I see you where you put E. I hear you where you put E. I see why you do. You're thinking, that's terrible. Like, how can you pretend you're not heard? As a doctor, like, good way of practice, that's terrible. Now, you'll see an E later on, by the way, and you'll see why you could argue this is not an E. Pretend you have not heard, as surely there are other medical personnel on board. This is definitely undesirable because A, you're basically lying, B, you're neglecting your duty of care, etc. But why is this not E? Think about this. Have you caused any harm by doing this? No. Is there anything that you could do that's worse than just not assessing? Probably. So you have to kind of think, even though, hold on a minute, yes, this sounds horrible, but it says that she's conscious, number one. You're 10 minutes away from a station. You know there are paramedics there. Yes, it's not good what you've done. You've not added any value when you could have added value. But have you knowingly made anything worse? Arguably not. So I can see why you put E. It's not wrong to put E. But you have to think, So now, because thing is, if you see it in black and white, everything will either be A or E. And obviously, this is an exam where things are not going to be A or E. You have to have things in between. So you have to start thinking a little bit about, well, have I made something worse? That's one thing that's really important to bear in mind. Well, have I made something worse? If you haven't made something worse, maybe it's not as bad as your brain initially thinks. Because your brain will look at it as black and white. Oh, but you breached GMC guidelines. You didn't assess. E. Yes. But have you made anything worse? Probably not. Therefore, can I justify it as being a D? Potentially. I'm trying to show you that sometimes you read statements and your brain thinks, got to be this. But you've got to take a step back and think, hold on a minute. Have I added value, taken away value, reached a goal, not reached a goal? And that's when you can start to make a difference. Okay, now we'll come on to an E later and I'll show you why it's an E. But this one you could argue is not as bad as what's coming up later on. Let's move on. Next one. Good. I'm not going to spend too much longer on this. This is a clear A, isn't it? Now that we've decided on the ideal end goals, number one, assess the patient. Number two, do a proper handover to the paramedics. You can see why this is an extremely desirable option because both of those things are ticked. Now, if you hadn't thought about those things at the beginning, then this wouldn't be such an obvious correct answer. Yeah. So hopefully you can see now having those end goals is really important because it can allow you to kind of rank almost when you're going through these options. So A, yeah, lots of people put A. One person put B. I'm interested why you thought this is only slightly desirable because what more can you really do in this situation? You've taken a history, you've examined the patient. Oh, and by the way, option A didn't talk about examine. So there's another reason why this is not strongly extremely desirable. Whereas this one said very clearly, take a history and examine and wait and hand over to the paramedics. You can't really do much more than that in an idle setting. And therefore, this is why this has got to be option A. Let's move on to another one. Okay. Again, a big range of answers coming in here. The majority of you are putting B's and C's, but there are a couple of D's and E's as well. And there's no A's that I can see, but it goes from B, C, D, and E. But the majority are going to be B's and C's looking at the answers here. So the suggested answer here is B, slightly desirable. Let's look at the endpoint. So you've got this lady who's conscious. And someone's been called to do some medical assessment and you know there's paramedics coming. So here, what have you done? You've offered to review her briefly. So this means that you've gone, you've had a look, you've made sure she's not collapsed, you make sure it's not anaphylaxis, you make sure it's not an MI, you make sure there's nothing immediate needs to be done. You reviewed her briefly, but you leave as soon as the train goes. So this can't be a undesirable because it's not like you've done anything wrong. You've actually gone and taken some action to look at this person. And then, yes, you've left, but you've left knowing that A, the person seems okay, and B, there are paramedics there. If you put C, I can argue this is a C as well. Neither desirable nor undesirable. Remember we talked about C being either nothing's really happened at all, you've not taken any steps, or you've done one good versus one not so good. And here you can argue that at least you reviewed her, but you're not really handing over. So it's kind of one cancels each other out. So if you put B or C, I can see that you do fine in this type of question. But if you're putting A, or you're putting E, then you want to just try and recalibrate your thinking a little bit because not everything can be A and E. Not everything can be black and white. You've got to start seeing the vaguer colors of gray and start to think about, well, what's going on? Now, people are saying, what about informing the paramedics? So this is why this is not an extremely desirable option because they haven't informed the paramedics. But it doesn't make it an undesirable option. Do you see? Like you can't put, oh, because of this and haven't done this, it must be down at the bottom. You have to kind of weigh things up. Now, there is a positive and there is a not so positive here. You can't only see the negative and therefore think, but they didn't do this, so it has to be down here. Because if you do that regularly, you're going to end up with top heavy answers, all A's, all E's, and if you're not sure, everything in the middle C. And that's not going to give you a good range of scores because the ideal scores are going to be somewhere in between all of them. Okay, so as we go through, really try and think your first gut reaction, but then think it through. Have I got justification for putting it like this? And maybe when you think of it in another way, you might realize, hold on a minute, maybe I could push it up or down. And that gives you a bit more rationale. Yeah. So the paramedics thing is right. but it can't be enough to put it right down to the bottom just because it doesn't mention paramedics here, because you have looked at them, which is better than not looking at them. And yes, you are leaving, but you're leaving having done a review, not without reviewing. There's a difference. Yeah? Subtle areas of gray that are really important to see in this type of assessment. Next one. Okay, again, range of answers. The good thing here is that there's no A's and B's, firstly, I don't think. No, I don't think there's so many A's and B's. But there's definitely C's, D's, and E's. C's, D's, and E's. Now, this, I'm going to argue, is the worst of the lot. Now, let's try and break it down. Why is this the worst of the lot? Because there are a lot of C's in there, and there are quite a few D's, but there are a lot of E's as well. Right. You know your end goal? Number one, assess. And number two, handover. It's your ideal end goal. Apologize that you cannot review her without your doctor's bag. Firstly, that's rubbish. You've actually thought about it. You've vocalized that you are a clinician, but you said that I can't even look at her because I've not got a doctor's bag. So that's not ideal, firstly, is it? Because you can do a review, you can look around the corner, you can make a quick assessment. You don't need a doctor's bag. So you've highlighted that you're a clinician, but you said that I can't do it because I haven't got a doctor's bag. But more importantly than this, encourage her to see her own GP later that day rather than see the paramedics. Alarm bells. You're advising this person to go and see their GP, which might be another hour, an hour and a half, and delay them seeing the paramedics. Someone's saying, I can't see how this is worse than ignoring a call for help. This is worse because without knowing the clinical problem, you're actively telling her not to see the paramedics. That could potentially be a serious clinical issue. If this person is having a meningitis picture and you advised her not to see the paramedics that are waiting to be assessing you in 10 minutes, but actually go all the way to a GP, can you see how that clinically could be worse than not doing anything at all? That has to be clear. Like, you're actually doing something here that can cause patient harm. That's the difference from not seeing somebody in the first place. Yeah? Good. That's really important. Now, when you read that first, you're like, it doesn't seem so bad. So you might put, okay, this is neither here nor there. Number one, you've actively highlighted yourself as a clinician, but said you can't review even though you could. And number two, you've given advice based on something that could be unsafe. That has to be extremely undesirable. Professionally, you've put someone in a potentially worse situation than not doing anything at all. Does that make sense? Put an X in the chat if that makes sense to you. You can see why when you break it down, that has to be the worst option. Great. Now, can you see how when we talked about option B, this one cannot be as bad as that one? Because at least here, you're not adding to any possible harm. You're not making an intervention that potentially could harm that patient. You're just saying, you're just not assessing. There's a difference. Whereas when you first read that statement, your first reaction is, well, that's horrible. That's E. It's got to be E. Now, there's an argument that you could put both as E, but you've got to have some way. What we're trying to get you to understand on this webinar is not that you need to get the exact right option. Otherwise, you're not going to get it right. That's not what this is about. It's about the process of thinking that not everything is A or E. There is grays in between. And sometimes I have to pause a little bit to see what those grays are. And that's where your technique can make a big difference. Yeah? Good. Before I move on to the next question, does that make some sense? Are you happy with that question? Shall we move on? Has that given you a bit of a framework to work on? Good, excellent. You just need a framework. You need a framework that you drill, you drill, you drill, you drill, you drill. Otherwise, you just go through these question banks and every question is different and there's no kind of learning throughout it. Is it necessary to rank all the options from A to E, or can there be more than one option with either? Yes, so you could have three which are slightly desirable. That's the difference between MS or ASJT, where you have to rank them all, A, B, C, D, E, and this one where you can choose the same option more than once. So yes, you definitely can. Okay, different scenario. Switch gears. Let's go. Oh, before we do, Quickly recap. Can you see how some of those things may come into play? Clinical, patient safety, better, worse versus personal safety. Convenience. I have to get to my friend's thing. There's a paramedic waiting. What's the convenience function? Communication. Do I communicate to the patient? Do I communicate to my paramedics? What's the best way to do it? Colleague support. Who have I got available? This will all come apparent in different cases. But you can see how the C's start to run through in those typical situations. What are the ideal end goals or goals? Helps you to categorize how good is this? What seems right versus what seems right now. This didn't really come into this one. This will come into other ones. Okay, let's move on to the next one. 10 more seconds, guys. Jot something down. Okay. Right. So as with the first option of question 1, we have every single option answered here. A, B, C, D, and E, and all of them multiple times as well. Right. Let's break this down. The suggested answer is B. Let's pull out a few B's. Well done, Kalash. Well done, Tony. Well done, Casey. Well done, Matthew. There's a few B's in there for sure. Let's try and break this down. Right. How do we approach a question? Number 1, we look at end goals. You're an F2 doctor in A&E, seeing a male patient with suspected PE. He's becoming verbally aggressive. He is angry about how long he's had to wait. You feel threatened, underline, as he's pacing the cubicle and he's punched the wall. Red flag, red flag. Okay? So here you're thinking about personal safety. You're thinking about all sorts of things going on. End goals. Number 1, I need to get out of this situation. Full stop. The guy's punching the wall already. I have to get out. I have to think about personal safety. When you've got clinical, you've got patient safety, you've got personal safety. I have to get out of that situation. Number 1. Number 2, is it good just to run and not do anything else? No, I need to alert other people because other people may be in danger. I can't just leave and run away. I have to alert the appropriate people. I need to make sure that the right people come to assess, to do whatever they need to do, security, whatever. Okay, so those are your 2 end goals. Number 1, get out of that volatile situation. And number 2, alert people when they need to be alerted. Those are your end goals. A, say that you have to leave under the pretense that you need to help a sick patient. 1 positive, you're getting out, personal safety. Negative, lying about the situation. Plus, you're not alerting anybody to any help. 1 positive, 1 negative, potentially could be C, but at least the most important thing has happened. You have left that situation for personal safety. Therefore, this is put as a B as opposed to a C. It's definitely not an A because, yes, you're out, but what about somebody else who walks in after you? It's not great. So therefore, it's not going to be A, but I could argue B or C. The reason it ticks it towards B is because at least you've got out of that volatile situation. Okay? Someone saying another end goal, being able to calm the patient down. We'll talk about that in a second. Okay, let's move on. Bearing in mind what we just talked about. Okay, a lot of A's coming in, which is good to see. A few B's. Actually, a couple of E's as well. Okay, we just talked about the 2 end goals. What are the 2 end goals? Number 1, exit the situation. Number 2, alert the right people. How many of these are you doing in this situation? Both. Panic button, beep, 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 calling for others. B, leave the cubicle. This has to be extremely desirable. Okay, has to be extremely desirable because you've got personal safety dealt with, alerting others to think about other people's safety dealt with, best possible outcome. What else can you do that's better than this? Think about it. What else can you do that's better than this? This is a guy who's already punched the wall. He's not somebody who's just starting to get a little bit frustrated. He's already punched the wall, like he's about to go. Right? What if that aggravates the patient? My question to you is, what can you do now that's not going to aggravate the patient? What else can you do that you think you're going to be able to calm this guy down? That's the question. It's reached a certain point where he's actually physically punched the wall. That's a big deal. That's a red flag. This is where you need to think about, well, I need to get people to help me here. Yeah. Don't try and be the hero and think, let's just try some empathy and settle this person down. This guy's punched the wall. There's a difference, right? You could be next. Somebody else could be next. Another patient could be next. It makes a difference. Call security. Yeah. So that's what you're doing with the panic button. The panic button is basically you press a button and the security comes running in straight away. That's what the panic button is. Yeah. My question is, because the patient has a PE, why wouldn't getting out of the situation and ensuring the patient gets urgent care be an end goal? But you see, so the question is, he's got a suspected PE. Remember, you're not leaving and that's the end of the story. You're not leaving and saying that we're not going to treat him. That's taking it way too far. That's extrapolating the statement. It doesn't say anything about leave the situation and leave him to deal with his PE himself. He is going to be treated, but you have to think about your own safety. Like, personal safety is paramount. Patient safety is important as well. If you feel threatened, how are you going to treat that person properly? So you have to get the right people to come, and then yes, he will still be seen. But at this point of time, you have to think about that first step. Remember, you're not thinking of the end goal. You're thinking of the next step. What's my next action? The end goal, there's many, many steps to come yet in this story. You're not going to end the story by one statement. You have to think about the next step. Yeah? Good. Excellent. These webinars, by the way, always create stuff in the chat. Like, what about this? Why not this? What about this? And that's fine. That's why we do them. And the reason we do this is not to show that this is the right answer and you have to get this, and if you don't, you're going to get it wrong. Because obviously it's all pattern-based, it's all stats-based. But if you're constantly making the same thoughts every time you see a statement, then you're likely to get a lot that are not in the right side. And that's what we're trying to kind of just funnel down a little bit by challenging these thoughts and getting you to think about them from a different angle. Good. Okay, next one. Okay, big range. Big range. The only one I can't see is an A. Okay, there's a lot of people actually who put D, which is great. A lot of people put Ds, a lot of people put Cs as well, which I can argue is fine. Suggest he makes a complaint to the hospital PALS, Patient Only Advice Labeling Service. Now, why? Well, firstly, why is it not E? Why is it not extremely undesirable? By doing this, you're not causing any patient safety issues. There's no personal safety issues. It's not that bad that it's extremely undesirable, because it's a reasonable thing to say in some situations. Why is it not reasonable in this situation? Because this guy's probably gone past the PALS complaint type thing, isn't it? It's probably gone past that bit. If this guy was just a little bit frustrated, a little bit annoyed, then yeah, maybe the PALS thing is a good thing to do. But this situation has gone way beyond that. And actually doing this puts you at risk of patronizing almost, and saying, yeah, you know what, you punched the wall, I know it, but you know what, here's a leaflet for patient, he can complain. Do you think that's going to really help when it's got to this stage? Probably not. If it's a few stages before this, I think this would be a reasonable thing. But there's nothing here to do for your own safety. There's nothing there to alert other people. So it can't be in the desirable phase. Is it neither nor? I wouldn't say not really, because you have done something, and that one thing could actually make things worse. In this situation, that suggestion could make things worse, and therefore it just pushes it down into the slightly undesirable. Yeah? Good. Someone's saying that there's no safety versus trying to calm him down. I agree. Therefore, you're thinking C. But is this the right way to try and calm him down when he's already punched the wall? Probably not. Like I said, if this was a few stages before, maybe that would be the right thing to do. I think we're just past that stage in this situation where putting a complaint option is going to help the situation. So, but again, I'm not too worried if you put C or D. That's not the point. It's just more about getting you to think about a certain way. But I'm glad that a lot of you guys are starting to get things on the right side and not having your kind of knee-jerk reaction. Because when the first few answers that we did, by the way, the answers were flying in within about 10 seconds. Now the answers are coming in a little bit later on. It shows that you're trying to take a bit of time to not go with that first initial thought, because often statements are a little bit more depth to what we first read. Excellent. Move on. Okay, good. So we've got a lot of C's, we've got a couple of D's, and we've got a couple of E's as well. And I think maybe one or two B's. So you're all kind of around that same point. So this is probably C. You know, we talked about this kind of funny answer of C where it's either got to be you're doing nothing at all or whether you're doing something positive, something negative. Let's look at what you're doing here. Pretend to answer your bleep. So you've left that situation, firstly, which is good. But then you move back to another room nearer to the nursing station. Now, it depends on how valuable you see moving to the nearest nursing station as to how you answer this. But the end result really is neither here nor there, because you've walked out, but you've brought him to another room and it's just you in the room. Now, yes, there's a nursing team nearby, but still you're in that situation where it's you and that patient in a room and this patient is extremely volatile. So can you see how even though you've taken some action, you've not really taken the story any further? Now, if you had informed the nurses at the same time, maybe you're pushing that up slightly more. But because you're in the same room still and you haven't informed anybody at all, you're not really in a better position. So that's why it's kind of neither here, neither there. You might as well have stayed in the same place. Can you see how you might as well have just stayed in the same place? You've not really made any difference, and therefore you can justify why it's neither desirable nor undesirable. Yeah. Some people are saying, are you making it worse by taking them near nurses? Okay. Somebody else is saying, isn't it better to take them near nurses? So can you see, there's so many different ways of looking at a statement like this. But from a bare basics situation, you are still in the room alone with this person and nobody knows. Can you see how in black and white terms, you're no different to where you were at the beginning? You're just in a different room. And therefore, you've not really gone up and you've not really gone down. And therefore, you're kind of in the middle. Yeah. Now, that's the first one we said is C. But can you see why that potentially could be a C, as opposed to some of the others that we put C earlier on? Good. Positive equals negative. Same situation. No real action. Yeah, good. Excellent. That's kind of how we're getting you to look at things, because you're still in the same place. Yeah. Excellent. Good. Okay, let's move on. Okay, excellent. 75% of you put E, around 25% of you put D. I think it's pretty obvious that most of you are saying that this is undesirable. It's just, what's the extent of the undesirability? Now, the suggested answer is extremely here because, number one, he's already volatile. He's already in a very high level state. And then this word is really important. Demand he calms down and basically threaten him. Now, that's a recipe for disaster, isn't it? That's not kind of slightly undesirable. This is no. This is like making it 10 times worse. If this person wasn't so angry and this word was suggest he calms down, yeah, this goes up the ranks. But extremely volatile, demanding somebody, threatening somebody, worst thing you want to do, probably going to make you more frustrated, more angry. E. Yeah. So for those of you who are maybe deciding between D and E, and if you went for D in the end, can you see how when you look at it from black and white, even though I tell you not to do that, if you can see in this situation, this has got to be an E, because there's nothing positive really that you can say about this, given the situation. Different situation, these words might be different, but not in this case. And I think most of you are happy with that one. Good. 2 questions done. These webinars are always fun because there's always so many things that you challenge me with, which is great, but it's just patterns, seeing patterns, training your brain to look at things in a certain way. Now, when we do our question banks, for those of you who've got our question banks, there's an ask a question box, and you guys know about this because you're all using it. So we get a lot of queries saying, why is this not extremely, and why is this not slightly, and etc. But now you can start to see why It's not so much whether you're getting extremely or slightly, it's more about the angles that you're constantly taking that are much more important in this type of assessment. Good. Excellent. Let's move on. Different scenario. Let's try it. Okay. So we've had a lot of answers of E, and we've had a few answers of D, and there's a couple of B's and C's as well. Right. This suggested answer is an E. Now let's try and break this down. So for those who put E and D, well done. If those who put B's and C's, let's try and break this down. You're a junior doctor on the gastro ward, and you witness the registrar raising a voice, basically shouting at another one of your colleagues, the F1 doctor on the ward. She's annoyed that the F1 is not summarized properly in the medical notes. The F1 doctor initially appears very upset, although then carries on with the ward round as normal. What's the right approach of action? Choose not to get involved as the situation is now settled. Now, certainly you wouldn't be able to argue this as A or B. It's not desirable. You can't just ignore a situation. You've seen a registrar basically shout at a junior colleague. You've seen a junior colleague get upset. Like, you can't ignore that situation. There has to be some action taken, because if you ignore it, then you're not thinking about the impact on your junior colleague or your colleague or F1 doctor. Is she okay? Has anyone checked on her? Is she okay to work? And B, you haven't thought about why the registrar got so annoyed. Is the registrar okay? Is something going on in their world? Do they need? Is that happening regularly? Is there other F1s that are getting affected? Can you see how ignoring it, choosing not to get involved professionally, is not really looking out for your colleagues? Yeah, so you can't really have it as an A or a B. D or an E. Why is it an extremely undesirable? Simply because I haven't done anything to see if my colleague is okay, and I don't know whether she's going to keep that with her for the rest of the day. I don't know whether that's going to impact her. Yes, it says that she carries on with the ward round, but what does that mean? Does it mean that she's not internally taking that to heart? It's going to impact her. She's going to cause her upset. Can you see how it's actually, when you break it down, it's an extremely undesirable thing to do, to just almost pretend that it's all fine. Make sense? But didn't we make things worse? How, I mean, until you speak to that doctor to see she's okay, how can you make it worse? But you can certainly make it worse by leaving it. Because if there is something there that that doctor needs support for, or that registrar needs action taking, like talking to one of your seniors, ignoring it is not the right thing to do. It could happen again to another colleague. Can you see the difference? But we didn't do anything to make the situation worse. That's what I meant. Yeah. But you haven't done anything to make the situation worse. Agreed. By ignoring it, you haven't made it worse, but you potentially have made it, you've not picked up an issue for your F1 doctor. You've not been able to support her as a colleague. GMC is all about supporting your colleagues, mentoring colleagues, making sure that people handle colleagues with respect. So if you do nothing, it's actually going to be looked at as quite bad. Because say, for example, I don't know, 2 days later, this happens again, or the FY1, because of this, doesn't come the next day, or whatever, she gets really affected by it. And then they're like, well, you saw that on the ward round. Why didn't you think you should say anything about that? Can you see, like, what do you say? Like, oh, well, I chose not to get involved because it seemed like it had all settled down. Like, it's not normal for a registrar to basically shout at an F1 on the ward round. I mean, on the ward round means in front of others, in front of patients, in front of colleagues. Can you see the impact that that might have? So A, that action in itself is not great. But then B, noticing that your colleague is upset and then leaving it could potentially make things worse. Yeah? Let's do a few others in this situation and see how you might think that other things are way better than this option. Yeah? Let's go through a few others. Okay, common answers, B, C, D, and a few E's coming in. Right, let's break this one down. So the suggested answer here is E. I know you're going to get really frustrated with me and just go, what are you talking about? Let's break this down. Why is this extremely undesirable? Okay, there are two really important reasons to think about here. Remember we talked a lot about that, what sounds right versus what sounds right now? Two things that are not great with this situation that don't help the situation. Number one, big, 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 big no-no. I cannot influence another doctor's anonymous multidisciplinary feedback. I cannot do that. Like, I cannot say, you know, when you get this anonymous thing where you have to give feedback on your colleagues, I think you should do this badly for them. Now, professionally, that is a no-no. Okay. Now, so if you're thinking like, yeah, B sounds pretty good. Yes, it sounds like it's a horrible registrar. She deserves a negative feedback. If she chooses to do that, that's her call. She does it. I cannot influence this in any way, shape, or form. This is extremely undesirable. Okay. An anonymous MDT feedback is how one colleague anonymously feeds back on somebody else. Encourage her to feedback on the anonymous is not great. Secondly, fair point. Someone saying it's not anonymous, it's not saying negatively, fine. But obviously you're encouraging her to do the feedback form. So you're not really saying give her a glowing feedback, are you? Can you see it that way? Secondly, what sounds good versus what sounds good now? How is this going to have any impact on the situation right now? Has zero impact. I don't know when this MDT feedback is. Usually it's the end of the job. That might be 3 months away. Now, if there's a situation right now where this registrar is actually doing this to other F1 doctors, or this FY1 doctor has been affected to such a point that is impacting her well-being, and I'm basically saying just, you know what, just leave it till 3 months and do some kind of feedback. How does that actually help the situation now? So this starts to come into that other bit of technique that we talk about, where sometimes we read things and think, you know what, that actually sounds pretty reasonable. But actually, does it have any impact on the situation at this point? And this doesn't. So it's a nice thing to do, maybe nice thing to say. Yes, she might give a negative feedback, but if she's struggling now, I need to help her now. And if this is an issue for the registrar now, it needs to be dealt with now. And therefore, this is an undesirable. So I can see why you might argue this as D or E. But can you see how this can't be seen as a desirable action? Because number one, it's not going to impact the situation at this point. And number two, by even telling them to do this, you're pushing it a different way. Now, someone's saying there's a similar question in the question bank, and the answer is B. I promise you they're different. I promise you they're different. There's different things that come in the statement that, because if you're going to write these kind of questions, you can see how a lot of these situations are going to seem very similar. But when you actually break it down, they're actually different. One or two words change the whole thing. Yeah. I mistook anonymous feedback for incident form. Yeah, fair enough. And I felt that's an escalation. So someone's saying that they thought this was kind of a incident form type of thing, SCA. Fair point. I can see why you think that that might be a positive thing, because A, doing an incident form, although that's mainly for patient safety misses, but doing an incident form is something that it takes place now. Like that's something that's going to be looked at now. It's not going to be in 3 months' time. So I can see why you thought that was a positive thing. And if that's what you did, then fair enough. But remember, in every job, everyone does an anonymous feedback on their colleagues. And that's what this is all talking about. Yeah? Good. Let's do another one. Okay, everyone is flying in 90% with A here, and a couple of Bs, and a couple of Bs. But the majority of you are saying A, and I would agree with you. This is A. Of all of the things that we didn't really talk about the end goals of this case, by the way, but what are the end goals of this case? Something needs to be done with the registrar, and something needs to be done with your F1 colleague. Those are your two end goals, right? You've got two things to think about. What do I do about the registrar, and what do I do about my colleague, junior colleague? So in this situation, speak to the registrar later in the day, discussing your concerns for how she spoke to your colleague. That's an extremely desirable thing to do because you are doing it, number one, at the end of the day, or later in the day. which means you're not doing it there and then in the middle of the ward round, which wouldn't be so desirable. So you're doing it at an appropriate time. Sounds like you're doing it with the registrar on their own. You're not doing it in front of others. And you're discussing your concerns about how she spoke to your colleague. So that's a very reasonable thing to do. And it'd be hard to argue why that's not slightly desirable, unless you say, but there's nothing there about the F1, which is fine. Which is why I think A and B are absolutely fine in this, but it's definitely on the upside as opposed to on the downside. Yeah, good. I thought this was slightly desirable because it doesn't do anything about the colleague. Yeah, makes sense. Yeah, so if you're looking at it from that angle, the double tick, this is only a single tick, and therefore you put it as B. I take that on board. It makes complete sense. D. Okay. Again, we're getting a lot of ranges between B and C and D. B and C and D are the options coming up here. And you can probably argue all three actually for this one. Inform your consultant about your registrar's behavior, as everyone has the right to be respected in the workplace. So let's think of reasons why this is a good thing. You're not ignoring it. You're talking to somebody who has the ability to take some action if necessary. You're talking to somebody senior than you to get some advice and discuss. What are the negatives? You're skipping the person involved altogether. You're not even giving a chance to talk to the person who's actually involved. You're going straight up the ladder. Secondly, you're going to a consultant, and consultants normally you go to for certain levels of things, patient safety concerns, patients being unwell, unsafe behavior. It's not really hit that category. But the most important reason why this is not a very good thing is that you kind of bypass the person involved. So generally when you talk about these situations where you have something that happens, the first general advice is you go and talk to the person involved first. So this is a good thing because you are escalating it and it has to be escalated, but it's not extremely good because you are missing out the person who's actually involved. And I could argue why this is a C as well, because you could say it's a good thing, but it's also a bad thing because of this. And that's where your subtlety happens. And that's where in terms of the marking, it's not you have to get it like this to get the mark, if you see what I mean. It's all like a graded statistical thing. Yeah? So someone's saying that I thought that you'd spoke to the registrar already. So this is a good point because you can only go on face value. So you can't kind of say, well, I presume that therefore they've already spoken to the registrar and now they're going to the consultant. Because if it was that, it would say, after speaking to the registrar, inform your consultant. So you have to kind of go at face value. You can't almost put things in or take things out. Yeah, but there's a lot more in this question. I can see a lot more congruence in terms of where you're putting our answers than in the first two, which is great. Let's finish this one off. Okay, so some variation on this one again, as they always are. The suggested answer for this is somewhere in the middle. And some people have put B's and some people put D's as well. So give full feedback on the registrar's anonymous MDT basically due shortly. Things that are positive for that. Okay, it's being flagged somehow. Like the thing that's happened is not ignored. Something's being done about it. Number two, it's your own view. It's on what you think based on, rather than suggesting somebody else they should do it, what you have seen and perceived is your own anonymous feedback. What's not great about it? It's only you've decided based on one thing to rate somebody's multidisciplinary feedback. Normally for an MDT, you're supposed to do it over a period of time and working with them for a long period of time. So you can't really judge it you can't give poor feedback based on one occurrence. And secondly, it doesn't really change the situation now. It's not great because this might be, even though it says shortly, we don't know when that is, when they're going to read it, who's going to act on it, is it going to go anywhere, and would it potentially miss an issue that I could have flagged up slightly earlier. So you can see why there's pros and why there's not so pros on this, and therefore it kind of fits so in the middle. But if you're putting B's and D's and you could see why there was a positive or a negative, I'm with you. I can see where you put that. If you're putting A's or E's, then probably you just looked at it and thought a snap decision. And actually, when you break it down, you can see there's good and not so good in this. And when you see good and not so good, it's not going to be one of those top or bottom rungs. Yeah. And interestingly, let me just break this down. The first 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13. The first 13 answers were A and E. And then after that, from the next 30 or so, there's only one extreme answer. So can you see how the first 13 answers were extremes? And then after that, i.e. the people who maybe took a little bit longer, didn't put that. They put one of the middle ones. Because when you look at it, after your initial reaction, you always see it as a different picture. So it's a good lesson to learn. If you're snap judging, then you're likely to put the extremes because that's what your brain does. It wants to make a decision, move on, make a decision, move on. This is just not one of those exams where you make a decision and move on. It's not like a spot diagnosis. It's not like, oh, I've seen a rash, I know what it is, move on, save time. You have to try and think of it a little bit. But good. I'm glad that this question, certainly, we're getting a lot more congruence than we did in the first two. Good. We're going to do one more, and then we'll have a bit of a pause, okay? Let's go into another scenario, number 4. Okay, what have we got then? B, C's, and D's. Always B, C's, and D's. We've got a few A's and we've got a few E's as well. So complete range, complete range. These are often the best questions to discuss. Complete range. So the suggested answer is slightly desirable. Now, it comes down to, again, what's your end goals here? So you an F2 in orthopedic ward, elderly Spanish man, understand limited English. Registrars gain written consent for hip-hop, scheduled for 2 days' time. One of the nurses quietly says to you that she suspects the patient was just nodding politely and actually understood very little of it. She says she does not want to undermine the registrar. You know his daughter visits daily and always translates if she is present. What are your end goals? Number 1, you've got to think about safety of the patient, isn't it? This person can't have an operation if they don't understand what they've signed. So you've got your kind of safety element to it here. It has to be flagged. You can't not flag it. And secondly, you can't make the decision as an F2 or foundation doctor to overrule this. You need to involve one of your senior doctors to think about it again, have another discussion, replan, make sure that consent is proper. So you've got 2 things. Number 1, you've got to make sure that the patient is doing the right thing and he understands exactly what he's signing. And number 2, you need to speak to somebody who can do something about this, turn it around, redo it, reassess it, etc. Address your registrar in front of the patient about these concerns, presuming the patient does not understand. Now, how many of those goals have you ticked by doing this? At least one of them, right? You've addressed the registrar, the person that's made the decision, the person that's done the consent form, you've flagged it up, that basically you don't think this is right, and it's going to at least need another rethink. So that's a good thing. What's a negative thing? Number 1, you presume the patient doesn't understand. You can't just talk over a patient presuming that they don't understand. And number 2, you've done it there and then, like in front of the patient, maybe in front of other people as well. Note it says here the operation's in 2 days' time. It's not like this is an emergency thing. It's going to happen in the next 30 minutes and you have to jump in right now. So when you weigh those 2 things up, you've done the right thing in not ignoring it and you've flagged it up to the person who's made the decision, but probably the way that you've done it is not the best. The timing, the situation, the manner doesn't fit with the time that you've got left before that person goes through the operation. So that's why it's slightly desirable, but it's the right thing to do because you have to mention it. The question is, what if the operation was due in 30 minutes? If it was due in 30 minutes, then you haven't really got time to do it in a nice space after the ward round, over a coffee. The guy's about to go to theatre. So therefore, doing it there and then would be a very important thing to do. Whereas in this case, that 2 days is really important. Every single bit of that statement is really important and it influences how you look at these questions. Yeah, let's do a few more and then we'll see how these come into play. Good. I'm going to pause it there because there's lots of D's coming in, which is great. A couple of C's coming in and a few B's as well. But by far, this is the question I think that we've got the most synonymity, if that's a word. It's D, slightly undesirable. Let's look at this. What's good about it? You flagged it up, like you've done some action. Okay, you've not just ignored it. You've not said, oh, whatever, big deal, it's all right, someone will pick it up. You've actually encouraged the nurse to speak up because the nurse was the one that suspected in the first place. So you've encouraged her to do it. What's bad about it? You've left it to chance. Like she's already said that she doesn't want to undermine the registrar. So, there's a good chance she's not going to say anything about it. Number two, you're not taking any personal responsibility. You've not taken it on yourself to check or to ask again if she's going to have done it or whether, there's nothing you've done yourself. And he just carried on basically with your own ward round tasks. It's happened, I've done my bit, I've told the nurse, and I've moved on. So on the balance, it's definitely bad versus good. Why is it not extremely undesirable? Because at least you've done something, like you've encouraged the person to do something about it. You've not just said, oh, well, it is what it is, and walked away. So you can't quite put it down as far as E, but it's definitely not got anything desirable about it because you've not taken any responsibility as the clinician on the team, but at least you've kind of flagged it in some way. And that's why it comes as D as opposed to E, but I can see why you might have put it slightly above on C as well. C. Good. Now, when you read this, what was the first word that came to your mind? Just put it in the chat. People are writing it already. Confidentiality, confidentiality, confidentiality. Yeah, absolutely. You have to think about confidentiality. But you see, the thing that you'd think is, oh, confidentiality E, confidentiality E. It's got to be E. It's breaking confidentiality. It goes to E. And I see where you're coming from. But remember, you can't just look at it as black or white. Oh, it's breaking confidentiality. It's got to be E. It's breaking confidentiality. It's got to be E. Because remember, confidentiality is a very, very, very important thing. But confidentiality can't trump things like patient safety, best interests, etc. So this is a mistake, by the way. It should be. It's not C. It's supposed to be D. I don't know why it's coming to C. It's supposed to be D is the answer. So it's not E just because your brain thinks confidentiality. It has to be the bottom. Has to be the worst. You've got to think, what's the positive of calling the daughter? Number one, something has been done about it. You can argue it's the wrong thing. It's not supposed to be done that way. There are other ways it can do it. But it's not E because you can't just be, because I've broken confidentiality, it's got to be E, because at least you've stopped someone potentially having an operation that doesn't know what's happening about the operation. Can you see why that would be worse? Like doing nothing and letting that person go to theatre, knowing that they have potentially signed something that they didn't know, is worse than getting somebody to come and talk to him about it and get the decision done right. So yes, confidentiality is a big red no-no, but you have to argue that leaving it alone and letting that person go for theatre is probably worse on the balance of things. And that's why, I don't know why this is C, it's supposed to be D. This would be a D answer as opposed to an E answer. Whereas what your brain will do, your brain will see confidentiality and it will almost blanket out everything else. Like it's hard for you to think beyond that because we've been drilled that confidentiality is such a big thing, which it is. But the problem with putting that at the bottom is that you're basically saying that I would rather this person has this operation without me being confident that he knows what he's talking about. Put an X if you saw, it's supposed to be D, by the way. This is a typo, it's supposed to be D, not C. Put an X if your brain thought confidentiality and it automatically dropped it to E. Now put an X, because I would have done this. Yeah, lots of people are saying X. And it's fine. Like I see where that comes from, because whatever exam you've done last, for a lot of you it's PLAB 2, it might be finals or whatever. That's what you're thinking. Confidentiality is a no-no, and it just shows how powerful these things are. But there is something worse. You know that the daughter comes in regularly. You know that the daughter always translates. It's not like you're not calling up someone in Australia and doing this that you don't know about. And therefore, that word confidentiality can't just block everything out. That's really, really important. Yeah. And the bottom line is, if you went home that night and you knew that that patient went for surgery the next day and you thought that, and you weren't happy that you thought that person actually knew what you were going in for, and this was the alternative option, can you see how you'd probably feel that actually, you know what, I should probably do this, given the fact that they come every day and given the fact that they always translate anyway? But really good example of what your brain does if you're not careful sometimes, and how we go to A and E straight away and we don't see the grays. Yeah? Couple more in this one. Yeah, I think this is a fair enough to put an answer without thinking too much about it. This is a bind or E. 95% of you put E. This is terrible, isn't it? But ignore, the word ignore just means you're not bothered. Oh, I'll leave it to somebody else. The daughter will probably ask about it anyway. It'll probably work out itself. Yeah, terrible. No responsibility, no action taken, apathy, ignoring. Yeah, this is definitely extremely desirable. This is worse than this, isn't it? Yeah, as you can see, this is definitely worse than this. And again, when you look at it like that, you think, actually, you know what? Talking to the daughter may not be the worst thing possible. Good. Last one of this one. Yeah, good. The other extreme. The other extreme. Oh, good. Someone put E and then put, sorry, A. Extremely desirable. Why is this really good? Number one, you're taking responsibility. Number two, you're acting on your hunches. Number three, you're talking to the right person. Number four, you're talking to them privately at the end of the ward round because there's no time rush. Yeah, all the right things. Ticks all the boxes. Extremely desirable. Now, can you see why this is extremely desirable? And talking to the registrar in front of the patient is slightly desirable because you've got that subtle difference, because you've got a 2-day limit. Whereas when you look at that at face value, you might think, oh, that's terrible, and it goes down to undesirable. But actually, when you look at the end goal, it's just behind this one, isn't it? And that's why you can categorize your level 1, 2, 3, 4, 5. And 3 in the middle are just as important as the top and the bottom. This is important. Hopefully you can see some of these coming into play, even subconsciously. You've got your clinical, patient safety, personal safety, convenience of you and convenience of others, communication between you and patients, communication between you and colleagues, colleagues that you have available to you, and colleagues that you need to support or seek support from. 4 C's can open up your thinking a little bit and get you to strategically choose rather than gut feeling choose. What are the ideal end goals? Super important. If you don't think what's the ideal endpoint, how can you rate other actions? Got to think about the end goals. And often there are 2 things that you might want to achieve. And that can make it quite a nice, easy system of marking. What seems right versus what seems right now. What sounds like a good thing to do? What's going to have some impact at this point of the story? These things, I promise you, when you get these working subconsciously without thinking about them, they make these questions much easier. If you strip all of this out and just have a gut reaction, you're going to put a lot of things up and down, whereas they could easily go somewhere in the middle. How's it going so far? We're only about halfway, by the way. But how's it going so far? Is it helpful? Is it useful? Does it make sense? Good. It's not stressing you out. Put an X in the chat if it's stressing you out. No, lots of people saying it's very helpful. Good, good. If you saying it's stressing you out, but it's still working, it's still useful. Good. Look, sometimes you need these little jolts. Look, 4 weeks to go. 4 weeks to go is a long time. If you can get these technique things working now, think how good you are going to be in 4 weeks when you're doing this multiple times every single day. At the moment, some of this is quite new, and maybe you just started preparation. Maybe you haven't started preparation today. Maybe this is the start of your preparation, which is a good starting point because you're getting those basic building blocks now. And I'm glad it's helpful because it's important to be aware of these because, if you haven't got these in your mind, you just can't use them. So the more you have in your mind, the more you can utilize. Okay, a lot of you asked about coupons, so apologies, it's been a bit of a delay. This is the coupon. If you want the package, it's FY2 Pass. FY2 Pass, that's 15% off. I'll quickly explain what is in the package. Like I said, a lot of you guys have got it already. We'll put the link in the chat for the package now. So it's a package that leads you up till the exam. It covers knowledge and it covers technique. So, for example, the SJT flashcards, they cover your core GMC knowledge. So, all the core rules, regulations of the GMC, professional probity, all the stuff that we've been talking about, confidentiality, all that sort of stuff is covered in the flashcards. You've got your question bank, which is where you can do multiple questions like we've done today, looking at the rating and getting your answers and rationales and why it's slightly and why it's extremely. You've got a bunch of mock exams that are the same time and duration and number of questions as the real thing that are designed to do maybe closer towards the exam rather than now. Now the question bank is for your kind of questions. This is to do later on. And then we have a live SJT course where on the 24th of February, where we're going to basically do this for many more questions. When you've hopefully done a bit more revision, when you've got some of these things more in your mind, we'll do a whole live course that you'll be able to watch back until the exam as well. Afterwards as well. So the coupon is gone in the chat. The link is gone in the chat. There are 15 coupons available tonight. 15. When those 15 coupons run out, then it ends, or it ends at midnight tonight, whichever the earliest one is. Depends how many of you use that coupon now. FY2 Pass. Okay, so that's going to be up. I'm going to just put a quick drink. So I've been talking a lot longer than I thought. Give me 2 minutes and we'll come back. We've got some more questions to do. And then we're going to talk about a plan for the next 4 weeks. Yeah. Okay, I'll see you in 2 minutes. Okay, I've come back because there's a couple of questions coming in, guys. Can we get retrospective discounts? I'm really sorry. A lot of you guys have already used the package, but we can't go and retrospectively discount everybody. I'm really sorry. This is just people who are booking tonight. When the coupons run out, midnight tonight, guys, midnight tonight, but I can see people are already using the coupons, but there are 15 available. So once there's 15 go, they'll run out. Otherwise, it's going to be midnight tonight. So it just depends on how you can do it. Can we just buy the question bank? Sadly, no. Most of our things come as full packages because the bank on its own, just doing loads of questions, doesn't give you that kind of background. That live teaching, the flashcards are all designed to work together. Do you have a package for preparation for interview? Yes. So once you get through this, we'll have another interview plus package, which will have a live course, a mock interview, basic things around the interview. That's a whole another thing. So we try not to mix it because it depends on obviously getting through this stage first. So yes, we will have an interview package. How long do you get access for? So generally, I think it's a 6-month thing. Just take you to this exam and beyond, because some people are using it for the last 4 or 5 months. Good. What was the date for the live course? 24th of February. That you will be able to book as a standalone course, but not yet. That will come out a little bit later on. Good. I think that's all the main questions answered. But I'm going to carry on because there's a lot more to do, and we're probably over time already. A few reminds about our socials. So we've got a couple of things. Is 4 weeks enough to prepare? Yeah, loads of time. I tell you now, a lot of people won't have started preparing. So 4 weeks is plenty of time. As long as you have a plan, you understand technique, you do enough questions, you do enough background reading. Yes, 4 weeks is more than enough. YouTube, Instagram, Telegram. We have our own FY2 standalone Telegram group. Some links will be going out in the chat in a second for that. So please do join that. Instagram, lots of teaching there as well. If you're on Instagram, have a look at us. We do lots of daily teaching for IG. And then there's loads of videos on YouTube as well, which are all very relevant to this type of exam. So all of our socials are always open for regular teaching and regular focus. Thank you to our partners, MPS. We're very lucky and proud to be associated with the Medical Protection Society. A lot of you guys already know about MPS. They do lots of work around indemnity and obviously working in the NHS. So we'll put a link out for them. So please do click that and see how they can help you when you get into your F2 role, which some of you guys hopefully will do by August time. Okay, next question coming up. Just give me a yes if you're ready. How many coupons have gone? I can't quite tell how many coupons have gone, but I've seen quite a few purchases coming in. So they're definitely rolling, but I can't tell you how many. I have to go into the website to check. Good, lots of yeses. So let us go. Question 5. I'll do these a bit quicker now because I want to make sure that we can cover all of them. So let's go. Okay, let's have a look at the answer. A lot of mixtures here between A's, B's, and C's. A's, B's, and C's. So let's look at the end points. Number one, you got to think about your own self-care, self-personal worth, self-improvement. That's number one. And number two, discussing with a senior, getting some support and advice from somebody senior. So I can see why if you put B, if you're looking at that type of strategy where there's two things that you want to do, this one talks about one of them. Reflection is a way of thinking about how you dealt with something, thinking about how you can improve, and then thinking about how you put it into action. So that's one positive. But the positive that's maybe not here is talking to one of your colleagues for advice or support. And therefore, if you put A or if you put B, I can see you're on the right track. D's and E's, there wasn't too many of those, thankfully. C's, I think this is definitely something that's got some desirability in it. Remember, reflection is a really, really big part of working in the UK, and you're supposed to reflect on clinical things and also non-clinical things as well. So the GMC is very big on this type of thing. And therefore, for you personally, in terms of your development as a clinician, this kind of thing, if you ever see reflection, it's always going to be quite high up there in terms of a desirable option for you to do. Next one. Good. I can see a lot of people are toying up between D's and E's, which is, I agree, how I would look at it. Um, why would I suggest it's not an E? Because you're not really doing any harm, I suppose. You wouldn't say that you're causing any problems, but it's not desirable because number one, you can't really say it's inappropriate placement for a junior doctor because palliative medicine is a very important thing of development. So you can't really say it's inappropriate. And secondly, who knows when that email is going to be picked up, read, discussed, thought about, even noticed. So therefore, it's not a desirable thing to do. I probably would put it away from being extremely because it doesn't cause any harm as such. But again, you could argue both D or E. But certainly it's not going to be on the higher rungs, A, Bs, because it doesn't really achieve anything now. And you can't really say it's inappropriate based on your own experience at this point. Yeah, good. Fantastic. You will getting the ideas now. So A, extremely desirable. This is extremely important, isn't it? Whenever you're struggling as a junior, don't try and deal with it yourself. Don't try and figure it all out yourself. Yes, do the reflections. Yes, think about how to improve things yourself, but always go to seniors for advice. Absolutely. So yes, A, speak to your clinical supervisor for advice. Always, always, always important. Good. Good. Again, there's a mix now coming in between C's and D's. And I said at the beginning of the webinar, I wanted to see a little bit of funneling in terms of how you're all thinking. And this is kind of happening in this question. A lot of D's and a lot of E's coming in this question. The reason I mean, it's definitely an undesirable thing to do, but why is it not extremely undesirable? Make a mental note to stop talking to friends or family about how you're finding working conversations. I suppose this is not saying that don't talk to anybody. If it said don't talk to anybody about how you're finding work, then I think it would be extremely undesirable because you don't want to just keep it all into yourself. But this just says don't talk to friends or family. Maybe as long as maybe they've got somebody else they're talking to, work colleagues, seniors, people who are other F1s or F2s. So you're not saying cut off. If it said cut off with everybody, I agree with you, it'd be extremely undesirable. But the reason I thought it would be slightly is because they still may have another outlet and maybe they just don't find friends and family the best people to talk to, but they do find colleagues to talk to. And that's why you can argue it's D or E. But if you put D or E, I think you're on the right tracks and we're thinking on the right lines. Good. This one's got a bit more varieties, but they all seem to be B's, C's, and D's with a couple of E's as well. So we kind of put this at the C category, neither here, neither there. You can argue it's B because you're doing a good thing by raising it with the educational supervisor, but it's not a great thing that it's at your mid-year review, which is in a month's time. Remember, you're struggling now, aren't you? So the positive is you're talking to the right person. The negative is it's not going to really impact you in any way at this point, and this is where you're struggling, and therefore it comes out kind of in the middle. One takes away another, and you end up in the middle. So it's C is either where you get a positive and a negative that balances, or whether this statement has got nothing to do with the situation. That's when you might think of a C. And in this situation, it's because you probably got a good thing and a not so good thing, and it kind of balanced up in the middle. But again, if you went kind of B, fair enough. I can see why you're thinking that. If you went D, fair enough. I can think why you're thinking that. But it's a good example, actually, of a nice middle ground C statement. Good. Next question. That was really, that was really good, by the way. That was a really good confluence. I could see the way that you're thinking, and it looks like we're starting to get some idea about that balance, which is really good. Let's go to the next one. Good. Once again, a lot of people putting A's and B's here, a couple of C's as well, but mainly A's and B's. This is suggested as an A, but you could equally argue it as a B as well. What are the two things to bear in mind here? You've got to think of number one, checking up on John. What's the impact of John? How's John doing? Is he okay? Does he need support? And number two, thinking about patient safety. Like, is there anything here that I need to be aware of from a patient safety point of view? It doesn't mention it here, but could there be? So those are kind of two things that you're thinking about. So the fact that you're discussing your concerns, A, informally, B, with the person themselves, C, in a non-threatening environment, that's probably enough to push it up to an extremely desirable thing, because you've taken everything into account when you're talking to John. If it just said, talk to John, then you might think that's a B. But because it's gone to the length of talking about how you're going to do it, when you're going to do it, and the fact that it's informal and it's only you and them, that makes it probably high enough to go to an A, but it could equally be a B as well. Option B. Well done, everyone. It's so good to see these things coming into fruition. A lot of D's, a few E's and a few C's, and a couple of B's as well. So let's break this one down. So the suggested answer is D, slightly undesirable. So alert the consultant of the unfair work burden to prevent burnout within the team. So the reason this is undesirable, well, there's a couple of reasons really. Number one, you're going straight to a consultant, which remember you wouldn't normally do unless there's an actual patient safety issue. So you're not going to probably go straight to a consultant. But number two, you're kind of already you've kind of already worked out that it's unfair work burden, and you kind of already made a decision that this is going to cause burnout. So you've kind of already gone a few steps down the line, and then to go to a consultant without talking to anyone else is actually quite a big thing. Like the consultant will say, well, what evidence do you have of this, and who have you spoken to, and have you found any patient safety issues? And if you've just gone straight to the consultant with this assumption already that it's unfair work burden, you're gonna have some questions to answer, and that's why it's undesirable. It's not extremely undesirable because you're not causing anyone any harm, but you're just not doing the best thing possible, and that's why it kind of goes D as opposed to E. So if you're between D and E, hopefully that suggests why it's D. I can see why you might put C, but I don't think there's enough positive in this to be able to pull it up, if you see what I mean. There's not really enough positives. You're going straight to a consultant and you've already made an assumption on what's going on. So it's a bit hard to justify positives in that one. Good, lots of answers coming in. A few more seconds on this one. So there's a bit more variation in this one. We've got C's, D's, and E's generally. on this one. C's, D's, and E's. This should go down as an E. You could argue it might be a D, but it comes down to that kind of thing that I just kind of will pass the buck. Really, it kind of goes to that pass the buck thing where I've noticed something. I know there's something that I should be doing issue wise, but I'm just going to pass it on to somebody else, and I'm just going to hope that they speak to him, and I want to hope that that leads to something. Can you see that's such a like how do you put it, a floppy statement? Like there's nothing really that you're taking any responsibility for. So actually that could be perceived as just apathy, really, that it's not my problem. I'll pass it back to the nurse and they'll sort it out. That's why this could be argued as being extremely undesirable, um, because you're not taking any action whatsoever, really, and you're passing the buck. And passing the buck takes no responsibility, and that's not good teamwork, and all those things are not seen as good traits, particularly in a situation where it's affecting other people. So if you're between D and E, hopefully you can see why this would be pushed down to an E just because of apathy. So if you ever see that somebody you're passing the buck, it's a pretty bad thing, when you think that you could take some action appropriately as well. Oh, sorry, this is all that answer already. Let's go through this then. Inquire about the patients John sees and discuss if he's struggling at work. So again, remember we talked about two endpoints of this. Number one, see how John is and make sure he is okay. And number two, think about patient safety. Can you see how this one ticks both? Inquire about the patients that John sees. So you're thinking, hold on, is there anything that I need to be thinking about patient safety wise? And then I'm also finding out if John's okay. So when you compare that to option A, which is also extremely desirable, you can see why you'd put that down as B because you're only dealing with one of them. And the reason this came up to an A was because you're doing it in such a good way. Whereas I can see why you might put that as a B, considering that you put this as an A because you're looking at two aspects of the end goal: the patient safety and checking the patients, but also thinking about your colleague and your colleague support as well. So sorry, I gave you the answer to that one. Let's do this one. You know what? Amazing. C is the answer because it's kind of neither here nor there, really. I mean, yeah, you could do an audit. I mean, when's that going to happen? Who's going to take responsibility for it? What's going to come out of it? Is it going to solve the problem now? So many questions around this statement. And it's so good to see a lot of C's. So good to see a lot of C's. There are a few B's, there are a few D's as well, which is fine. And you might have your reasons to do it. And I'm pushing you a bit on time on these questions. But it's so good to see C's being used in the right construct for doing a C. Earlier on, C's were coming left, right, and center, whereas now your C has been given the right place. So it's really, really good to see. So well done if you put a C. I agree with you. It's kind of neither here nor there. And also, like we said, it's not going to happen now. It's not going to change the situation now. This situation is happening now. It's a nice thing to do, but it's not going to do anything now. It mentions ongoing audit without knowledge of that. Is that not lying? It mentions ongoing audit without knowledge of that. Is that not lying? No, it doesn't say that you're not going to tell anyone about it. This is not a discrete audit. It's something that you could be doing. C is tricky for me, but it's the first time with this format today. Yeah, C is always tricky. But again, if you're thinking either it's got nothing to do with this situation, it's not going to benefit in any way, or one positive, one negative, C is a great way to go. Good. One more question to do. Question 7. Let's make this a good one. Let's go. So mixtures of B's and C's coming in here. Yeah, it's about 50-50 actually. B's and C's. We put this down as a C because I can see what you're thinking from a B point of view. It's a good thing to do, but it comes back to that thing of, well, when's it going to happen, and what's the impact going to be, and is it the best thing to do at this stage to try and help with the situation? Yes, you can raise it at the monthly junior doctors forum, but if there is a problem with the supervisor going off for long periods of time and trainees being left on their own for long periods of time, it's probably beyond raising it at the monthly junior doctors forum. This could be an actual like a safety issue. This needs acting on really, and therefore this is not. You could even argue this is even down into a D, because it's a nice thing, but it's not going to really impact the situation at this point, and therefore I'd struggle to put it into the top two categories. C or D, I can see it being pushed in and around, but yeah, it's all about that. What sounds good versus what sounds good now. What's going to have the impact that I need it to have? Because, but you know, this is important. You can't have trainees on their own without a supervising clinician, and you raise very different kinds of things at a junior doctors forum. Yeah, so just that balance of the right outlet's important. B. Some similar patterns here coming out, isn't it? In questions. Yeah, so this is actually a put in because it's a similar thing, isn't it, really, to the previous statements. The previous statement is raise the issue at the monthly junior doctors forum, and we talked about it kind of not being neither here nor there. Here you're talking about provide negative feedback at the end of the placement feedback form. So again, where's the impact? Like if this is a big deal, you know, this is a big deal. There should be a supervising doctor on site all the time. So if they're going away and you're going to put this on a feedback form when they get hundreds of feedback forms at the end of a rotation, something could have happened way before that. So here again, you'd struggle to put it in A and B because it sounds good, but actually when you break it down, what's the outcome? Like what's the end game of this? Okay, so you write a negative thing. Is it going to be picked up? Is it going to be acted on? Is the next job going to be improved? Who knows? Therefore, you'd have to look at C stroke D really, as opposed to A or B for sure. And that's why I think a lot of you have put C's and D's, but a few put B as well. But I just try and recalibrate a little bit and think this is in a potentially a long time. You've only just started the rotation 2 weeks ago, and you're talking about end of placement form. That could be 3.5 months, 5.5 months, depending on how long that rotation is, right? So again, you have to just recalibrate time frames as well. C. Yeah, good. This has to be up there, isn't it? I mean, you're doing all the right things. You're not waiting. You're doing it this week. You're talking to the right person, clinical supervisor. You're acting on patient safety. Yeah, you can't go really anything below an A. There's not really anything that you could say that puts this even into a B really, because this is exactly what you do as a junior doctor when you're feeling like in this particular type of place. Good. Good. I was holding my breath to see what are you guys going to do. Yeah, extremely undesirable. Gone are the days where it's just like, oh, as a junior doctor, just suck it up, deal with it. It's not a big deal. Don't make a fuss. Gone are those days. Long gone are those days. Patient safety, you have to raise it. Do nothing as 2 weeks is not. That's just apathy, because that's actually dangerous, because you're thinking, you know what, I don't need. I can just deal with it. I can deal with no supervisor. I'll just make decisions. I'll do what I think is right. And then if you don't sort it out, the next trainee will have the same thing, and it's going to go on and on. So yeah, definitely an E. You can't even put that as slightly. There's nothing good about ignoring situations, especially when there's clinical safety involved. Good. Last one. Okay, I can see a big range already from B's down to E's. B, C, D, and E. You've had no A's, but B, C, D, and E. This is actually an okay thing to do, because if you look at the situation, you're seeing patients on your own. You've got no supervising doctor that you're supposed to have. What you're saying is, I'll see the patients, I'll deal with them, but I'm going to check in the lunchtime any patients that have a doubt on. Now, that can't be extremely desirable, because the extremely desirable thing is to speak to somebody and get it sorted out, because it's not an ideal thing to do. Whereas here, what you're saying is, I'm I'm still going to be safe. I'm still going to speak to a senior clinician, but I'm just going to wait until lunchtime. The reason this can't be extremely desirable is that if somebody had a, I don't know, suspected meningitis, go back to that, and you're saying I want to wait till lunchtime, that could be a patient safety issue. If you make the wrong call, don't send them in, whatever it is, PE, whatever, then that's clinically not safe. Therefore, it's not going to be that A category. But it actually is still good that you're saying that even though I haven't got my supervising clinician, I still am going to make a list of questions, and I'm going to make sure that day, same day, within a few hours, I want to speak to somebody about it. So it's still good. You can't say that's undesirable. You're not doing anything wrong. The only thing is you can't put it at the top, because those few hours could make a difference. That's quite a nice one to end on, actually, because you can see why. I can see why when you first read that, you think that's not great. It's probably a bad thing to do. But actually, when you break it down and think from the for that, someone said, is the timing reasonable? That's what makes it not an A. That's what makes it not an A. Because A would be when you have a query, you speak to a senior. That's A. Here you're saying, I have a few queries and I'll speak to them in a few hours. That's why it can't be as good as A. That's why it has to drop down a level. It's still positive. You're still saying, I know I've not got any supervisor doctor here, but I'm still going to take the responsibility myself to talk to a senior person when I have a doubt. That's still good practice. It's just the timing means it's not as good as it could be. And that's why it's above C, but it's not up to an A. So it's a really good one to finish on, because, and I think if you'd have done this question at the beginning, I think we would have got a much bigger range of answers than we got here. So it's really good to see, as we've been through those second set of questions, how we have funneled down. If you look at the earlier questions, we were literally spread all over the place. And that's what tends to happen with these questions, particularly if they're new. But once you get your brain in that right place and you're understanding what my goals are, and how many of them am I ticking off, and what's right versus what sounds right now, and there's 4 C's, you start to come into congruence. And the more congruence you get, the high scores you're going to get. You don't have to get every single one, every single exactly the same point, because it's one human thinking against another human, and people are going to have different views on different things, particularly around the middle. But as long as your general patterns are in the right skew, then you should do well on these type of questions. It's really, really important. But hopefully what you've taken away today is, it's not just about gut feeling. It's not just about do thousands of questions and magically it'll get better and you'll know how to do them. It's about thinking strategically about what's your brain doing and what are my focuses on. Am I focusing on the ideal end goals? Because if you're not, what are you doing it against? What are you comparing them to? Right? You've got to have your end goals. You've got to have this in your brain, that I might think a lot of things sound good, but actually what sounds good now? What makes an impact? What's going to change the situation? Or is this going to do something in the future that might be good, but that doesn't mean it's good now? These two things are important. And then having these 4 C's in your mind just to fall back on when you're not quite sure. Is it a B or is it a D? Clinical, convenience, communication, colleague support. When you put these together, it can allow you to creep up those marks from a technique point of view. Because knowledge is one thing, practice is another thing, technique is a big thing. And if you don't focus on technique, it will make a difference in your overall score. I've been seeing coupons flying through, guys. So I don't know how many coupons are left. I know a lot of you guys have viewed coupons this evening. So if they're still left, this is the coupon, FY2 pass, until midnight tonight or until 15 have gone. And I don't know how many have gone, but quite a lot have been coming through. So that's the whole package. Live course on the 24th. Don't forget our social media, YouTube, Instagram, and definitely our FY2 Standalone Telegram group. Just go to Telegram and search Arora FY2 Standalone. You'll find it straight away. Instagram, maybe just search the name, you'll find it as well. Thank you to our partners, NPS. Final 4 weeks then. What are you going to be doing? Number one, dual-based approach. That means, number one, doing questions, yes. But number two, building up your understanding, going through GMC Good Medical Practice, going through the SJT flashcards, going through the ethics, going through what your role is as a junior doctor, so you can put some context into decisions that you're making. Don't just rely on questions. Make sure you understand the background as well. Number two sources of questions. If you've got a question bank already that's not ours, just don't stick to one source of questions, because your brain gets very used to one style of questions. And then when you get to the exam, it's a different set of writers, and you're just not quite sure how they write questions, and it just throws you a little bit. So you don't, even if you don't get ours, just get 2 different sources. because at least then your brain's not going to get used to one style of question where you're almost answering questions because you know how they write the questions. Technique is huge. Put an X in the chat today if you hadn't really thought about technique, and now you have thought about technique. Let's just make sure we've got enough people on the right page. Good. Technique is huge, 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 huge in this exam. If you don't get it right, then it can cost you a lot. If you get it right, it can pull you up significantly in terms of your overall score. Make sure you know GMC Good Medical Practice. Like we said, the flashcards in the package go through all of the key points that you need to know from a probity point of view. Telegram group, just for support, asking questions, lots of things go on that group in terms of queries, applications, etc. Live SJT course on 24th of January. That's an important date to get in the diary. We'll be going through this in much more detail once you've had a chance to go through these things between then and now. You've got about 3 weeks to kind of build on this before we go into that live main course. Thank you guys for today. Firstly, thank you for your answers. Thank you for sticking with me. Thank you for trying out those questions. Thank you for getting them right, wrong, in between. That's what today's all about. It's all about practice, but practice through purpose, not just practice for the sake of practice. It's practice through purpose. And I'm really glad that you guys hopefully found it of value. Thank you for the kind words that are coming through. I'm going to leave you guys. It's a bit later than I promised. Apologies, 28 minutes later than I thought it was going to be. But I hope you feel much better, more confident. My aim was to make you feel like you're a bit higher on the rung in terms of getting ready for this exam. The coupon is available, like we said, FY2 Pass if you want it for tonight. Have a super evening. Thanks, Dr. Pooja, for sticking in the background and answering questions all along as well. We'll try and get this up on YouTube at some point in the next week, so you can go and watch it back at some stage once we get it all edited out. But you guys are awesome. Hashtag Campus will pass. We'll see you guys on the live course on the 24th of Feb. Take care, guys. See you soon.